Good morning, SLO. I'm happy to be here and to talk about the community health assessment. I bet you're thrilled that I'm not going to talk about COVID. What exactly is a community health assessment? It is a collection of mostly local and county data across a broad array of indicators. So why now? As you heard Jim say, we do this every 5 years, but let's be honest, last 5 years was the first time. So we're now at our next interval of 5 years. We have always done health indicators in small annual reports back through time, but this is the time that we do this really robust assessment of all the community health indicators. The thing that's nice about this now is that it's online. So previously we did a book that we handed out, but now with it being online, we can update information as we go and don't have to wait 5 years to give you the most up-to-date information. So I want you to think back over the last few days, the steps you took, the food you ate, the ways you got around town, the bills you paid, the times you connected with others, and the worries that you carried. And consider the ways the world around you made it easier or more difficult for you to be healthy. Maybe you were able to walk or ride your bicycle here today, although it's a little cold, and get a bit of exercise. Maybe you tried to make a doctor's appointment who could take your insurance, and that was quite difficult. Maybe you tried to make an appointment for your child at a dentist or a mental health therapist. Maybe you skipped a workout or time with the family because you worked longer hours to make a few extra bucks to deal with the housing cost. These are the kind of factors and more that we look at in the community health assessment. It helps to make some of the invisible factors around us visible, and it documents the health impact of those factors. Our CHA, as we call it, gives us the opportunity to understand how our community supports health and where we can improve. This assessment gave us the chance to look not only at the hard data from public health and other state data sets, but it also gave us a way to listen to the community through a large survey that we conducted. That survey, by the way, we were aiming for about 300 people to feel that it was valid statistically, and we got nearly 4,000 responses. So we were happy with that. Diving into the data, we find that we are healthier than most communities in California. Some of the positives that we have are that heart disease, though still the leading cause of death, has been declining. In the last 20 years, the number of adults diagnosed with diabetes in the United States more than doubled. However, in SLO County, that factor has remained low. The rate of teen births has continued to steadily decline. And yes, even COVID-19, all right, I couldn't go without saying it. Deaths and hospitalizations have had a downward trend, and that's due to vaccines and treatment options. You're still able to get your vaccine, by the way. Sorry. We also, though, have areas where we struggle and can improve. Strokes in our community are higher than the state average. Residents report tremendous stress in our survey related to finding and keeping housing within their budget. Accessing care for both physical and mental health can be very difficult. Our drug overdose deaths have risen sharply and even surpassed the average for the state. Data also shows stark differences in areas of the county by neighborhood even, where things are very different in terms of you all perhaps have access to walking trails, farmers markets, lighted streets, but that's not true across the entire county. So these highlights that I've shared are just the tip of the iceberg. I encourage you to go to slohealthcounts.org. We also have brochures in the back that have some of this information, but go to the website so you can find data on infectious disease, chronic disease, access to care, infant and maternal health, substance abuse, and much more. Okay, so now that we have this data, what do we do with it? The most powerful use of health data is to inform action, and that's what we intend to do with this assessment. The work ahead will come in the form of the Community Health Improvement Plan, affectionately known by us as the CHIP. This is our community strategic plan for health. The plan will be developed by SLO Health Counts, which is a collaborative of community members, nonprofits, government agencies, cities, schools, and leaders in SLO County working together toward the shared goal of a healthy, thriving community. The CHIP will be released in 2024. Finally, I want to say thank you to the thousands of community members who shared their insight through our surveys and interviews, and to the community leaders of SLO Health Counts who are using this data to work alongside us in addressing the urgent health issues our community faces. This is the community health assessment, not just public health. We welcome you to use it, be part of it, and make plans for health improvement based upon it. Thank you.